and welcome to NAFDAC and Your Health, where we bring you all the important information you need to know about NAFDAC. The agency is saddled with the responsibility of safeguarding our health by ensuring that the foods, drugs, cosmetics, and medical equipment made available to us are safe and wholesome. My name is Tosin Adebayo. On this edition of NAFDAC and Your Health, we join the world in marking the International Day Against Drug Abuse and Trafficking. NAFDAC has over the last few years ramped up its campaign and enforcement in the areas of drug abuse, misuse and trafficking, deploying various channels for stakeholder engagement and collaboration, public enlightenment, and indeed regulatory oversight and policy reinforcement to tackle the menace drug abuse in Nigeria.
This day is extremely important, and it should also continue to jolt us to have high alerts in terms of drug substance abuse in the country.
NAFDAC's role in stemming the tide of drug abuse in the country goes well beyond investigations, enforcement, and prosecutions. The agency also engages in several enlightenment and sensitization programs.
From elementary school, we have to have a curriculum that will show the bad effects of drugs, how drugs can destroy brain, how drugs can destroy future, So these are the things that we're supposed to do. In the universities, secondary schools, for example, NAFDAC has what is called the YADA program, Youth Against Drug Abuse. We partner with many secondary schools in the country to make the children aware of the bad effects of drugs. Our narcotics division, directorate, they have an outreach to the army where they go to the army schools, army children's schools in the barracks to teach them about the dangers of drugs. They work with the families, and they also educate the mommy markets in the different barracks, because that each sector in the society, just like you said, has their own problems. There are so many things that we do in NAFDAC in terms of curbing drug abuse. Drugs can be misused. Regular drugs can also be misused, and that is where we come in, pharmacists come in to educate our people. If your mom gets a drug from the doctor, you shouldn't take that drug because you are ill or whatever. You should get advice from the doctor. There are drugs that are used medically, but they can be misused.
NAFDAC has adopted a multifaceted approach, a multidimensional approach that includes regulatory measures, public enlightenment campaign, advocacies. What NAFDAC is emphasizing, as it were, is the issue of what we call the behavior change communication. The very first thing the incumbent Director General did, Professor Mojisola Christian Adeyeye, was to quickly confront this issue, this behemoth. She confronted it by launching what we call the YADA, that is the Youth Against Drug Abuse. In other words, declaring a war against drug abuse, but using the youths as the foot soldiers in the forefront of the campaign. And that partnership with the Young Pharmacists Group, because we had to leverage on the professional skill and also acumen, and also the dexterity of the young pharmacists that are spread all over the country, so that we had to galvanize them and recruit them into the forefront of the campaign against drug abuse, so that they take charge and be able to reach out to other young ones in the country. Because if you truly also want to win this war, you have to use the youths who can also reach out to the youth population that are involved in drug abuse. And that, apart from that, we're also working closely, collaborating with the NYSC. The DG is taking it very seriously. And at the heart of this collaborative effort between NAFDAC and NYSC is the setting up of, the conceptualization of NAFDAC desk that to be set up at the 774 local government areas in the country, using the youth corpers as the desk officers manning the various desks. We're also engaging the traditional rulers, because when the drug abuse campaign was flagged off in Kano at the in Kano, the traditional institution was also directly involved. So we're using a multifaceted approach and trying to engage all the socialization agents in the country, the traditional institution, even the teachers, the religious institution. Some of the things we used to do in the past, trying to also to bring it back on board and strengthen it, the mechanism towards winning the war against drug abuse.
The incidences of drug abuse in Nigeria had reached a near epidemic level, according to the Director of Narcotics, NAFDAC. But a number of innovative solutions have been put in place to curb this.
There was a tripartite meeting between Ghana, Nigeria, and India in New Delhi, and then there was also a follow-up, and this time around we had to involve all the West African countries, both the Francophone and the Anglophone, so that we could look at this issue of menace. And we also have this arrangement with India that if we issue a permit to any importer or manufacturer of tramadol, first they will have to ask for no objection from us so that we can confirm the authenticity of the permit. And then it's only after that that the shipment can be allowed to proceed.
In Ibadan, Oyo State capital, the agency embarked on surveillance and raid of premises suspected to be a hub of medicine fakers and adulterators. This was in response to the information received from a concerned citizen.
I want to commend the members of the public for their collaboration with NAFDAC, but for their information and intelligence, we wouldn't have been able to get this counterfeiter in Ibadan, who tells us that he's a lone wolf. We know that he was working with some other people. But the fact is that getting this man means dismantling that chain.
We carried out some surveillances and monitored the place for some time. Then on a set day, I was directed to lead a team of NAFDAC officers to go and find out exactly what was happening in the place in Ibadan, Oyo State. So we took off and we got there. When we got to the place, we were hanging around the place. We saw some labels, and so we were assured that something was actually going in there. So we got into the place, into the house, and then we now noticed that it was a mini manufacturing plant. So many packaging materials, so many cartons, up to about 100 cartons of already produced known brands of pharmaceutical, mostly liquid pharmaceutical. And as we were going around, we found most of the like these bowls, they were liquid, the cough syrup was inside the toilets, and a lot of bottles soaked in big drums, plastic drums. And as we are going around, like you see, we saw so much label, so much cork, so much packaging materials. Then we saw this carton containing tramadol packagings for tramadol, and a lot of them have been opened. Though we suspected that he was mixing the product with tramadol until we asked him, and he confirmed truly he was mixing what he was doing with tramadol just to have the narcotic effect of codeine, so that when people take it, they will be high. Then we now noticed that most of the productions were done in a toilet. 2 toilets, one here, plenty, too much of the product. So we now had to move out every single thing that had to do with the production. The finished product, the packaging materials, the corks, the empty bottles, we had to move them. And then we also moved his gadgets, which were mostly plastic bowls and toner. This is what he used to obviously stir or mix it with the tramadol to pour out to go and give to the public. So we now evacuated everything, and we had to start going back to Lagos, having accomplished our mission.
NAFDAC and your health will be right back. Please stay tuned. Welcome back. If you are just joining us, you're watching NAFDAC and your health.
Public should be aware that drugs are chemical substances that needs to be handled with care, else its adverse effect could be injurious to the health and may in turn lead to death. Meanwhile, getting it from a registered pharmacy could lessen the risk.
NAFDAC also opens its doors wide to accommodate institutions such as corporate organizations, youth establishments, as well as schools, educating them on the dangers of drug abuse. In making sure that pharmaceutical products are judiciously used by only those who are in need of it, the agency has provided documents to equip practitioners in the industry with adequate information for proper use.
We have developed guidelines with technical expert groups with the Federal Ministry of Health that have been launched and we have disseminated so that people can begin to manage pain effectively. In fact, there was this requirement to even review the curriculum of the schools of medicine, pharmacy, and nursing services so that people understand exactly what they need to do with those class of products, so that you don't have to have the fear. Because when you use it for illicit medical use under supervision, the incidence of dependence is almost not there. But when you have that fear that it causes dependence, because you know it's addicting, so you are not going to prescribe, and then you go for medicines that are not as effective, you are denying people who have illicit need from not having access. Meanwhile, the people who don't need it are abusing it. We have also built capacity. The government has approved designated narcotic stores in all the zones. So at least we know exactly where this is supposed to go. And from there, we can monitor. We might even say, look, let any product meant for a particular location be so coded that if you look at the batch code, you can tell where it is coming from and where it's supposed to be, so you can track it. And if you dispense a controlled medicine, you are supposed to keep that disposal record. So when we go to verify, at least we know that yes, your poison book is there, the prescription is there, so we can always confirm.
NAFDAC's constant war against drug abuse in Nigeria has yielded positive results. However, the agency has determined to do even more in surveillance and enforcement against the menace as it threatens the treasured health and security of Nigerians.
It's been a whole lot of success, but we have to continue. We find there are a lot of containers of tramadol we have seized and we have destroyed. And the street value is over 1.7 trillion naira. Just imagine that getting into the supply chain. Imagine how many people will be killed. Imagine how many people will be so blown out that at the end of the day they will affect other people's lives in the society. Imagine the people on the road who, out of the use of tramadol, they could hit other people and kill. Imagine the marriages that would be affected or destroyed as a result of the use of tramadol. So what the agency has done so far, we will sustain. We will continue to do it. And more so, we have cases in court. We have cases in court. We have charged a whole lot of people to court. And we are using this opportunity to talk to the National Assembly to please have a second look at our law, where we have tried to review the penalty. The penalty now is too low. 500,000 naira. I mean, what is 500,000 naira as a fine? Some people can readily walk into the court, have 500,000 naira in their pocket and do what they are doing, and they pay it, and off they go. So we are asking the National Assembly, we are asking for a life jail term. So NAFDAC, we are not going to rest on our arse. We are fighting and we will continue to fight. As long as they don't want our people to have what is good, what is of right quality, what is safe, what is efficacious, we will not allow them to rest. So we will continue until they are finally rooted out.
How Alcohol abuse is another area where the agency is working relentlessly, especially for underage drinkers. NAFDAC has taken its mission right to the source and is collaborating with the Distilleries and Blenders Association of Nigeria to sensitize young people and indeed the general public about the dangers of underage drinking.
What the agency is trying to do, NAFDAC is trying to do, is to strike a balance between consumption and safeguarding public health. That is what essentially we are trying to do with this campaign, strike a balance and also ensure that the industry is in business to be able to employ people gainfully and stay in business. And just to reiterate the refrain of the industry, that why they are also interested in this campaign, which actually resonated with NAFDAC when they made that case, is that the people have to be alive to be able to patronize their business. So it is also in their own interest, corporate interest for the consumers of them to be alive and be healthy, because they need more people so that, and NAFDAC is also ensuring that they are strike a balance.
Underage drinking isn't the only health crisis the agency is working to eliminate. The widespread consumption of fake and unwholesome alcohol is also of great concern to the agency.
Some of them, what they do, they use, what is it called? They go and pick bottles. The other day, we got a lorry load of, truckload of empty bottles, which they use in producing, especially the customized bottles for some of these well-known brands. Like you have Hennessy and the rest. They go and do all that with all these bottles. So we are calling on our people to please go to the right place to make their purchases and get your receipt. Get your receipt. Get your receipt. And also, we're also talking to the nightclubs. After dispensing some of these products, they should not leave the bottles empty and all that. And we have even discovered that some of the nightclubs, they patronize these counterfeiters. They do that. So people should be careful what they consume. This is food fraud. And also, we've been working with Interpol on this. Interpol, and there's an international organization of spirits. They're also in Nigeria. We work with them. We all been working. So they have a device, a security device, which they use in differentiating the counterfeit and the fake.
Recently, the agency, in collaboration with the United Nations Office on Drug Control, UNODC, and the International Narcotics Control Board, INCB, released its INCB Annual Report and Precursors Report of 2021 in Lagos. The Director General of NAFDAC, who was represented at the occasion by the Director, Drug Evaluation and Research, Mrs. Nwankwo, enumerated strategies with which the agency is tackling the challenge of drug abuse and misuse.
It is a results-based blueprint for coordinating interventions against illicit drug use, trafficking, and other related organized crime in Nigeria. While it is a treaty obligation to ensure availability and access to controlled medicines for COVID and other medical needs, effective measures must be taken to address drug-related problems in compliance with international human rights standards and norms. There is no doubt that the issues concerning diversion and drug use require the deployment of measures to secure and strengthen the supply chain. Effective surveillance and continuous monitoring are necessary to detect diversion in real time. Other strategic proactive countermeasures put in place by the agency include the following: import authorization to companies with registered products and satisfactory records of distribution, considering the country's allocation by the International Narcotics Control Board. Issuance of authorization to clear from the ports of entry, warehouse inspection to ensure satisfactory storage and inventory control, deployment of the reviewed inventory keeping tools, targeted drug demand reduction by carrying out drug abuse awareness and sensitization campaigns in schools, marketplaces, religious organizations, etc. Collaboration with National Drug Law Enforcement Agency, non-governmental and civil society organizations in drug demand reduction activities. All the things I listed above are steps that we have taken in-house to help stem drug abuse in Nigeria. The report being presented today gives insight into the global situation with regards to controlled medicines and provides effective strategies to managing our healthcare services, as well as drug use situations. It is in recognition of this that NAFDAC is hosting this national launch of the report. We appreciate you all for your support to NAFDAC and Nigeria in general. We have aligned our activities to our quality policy and shall continue to build upon the synergy that exists amongst us to identify, disrupt, and dismantle organized criminal groups operating across jurisdictions. Finally, I wish to express my profound gratitude to INCB, WHO, the EU, the UNODC, and all other partners who have supported our efforts at ensuring availability and access to internationally controlled substances for medical and scientific purposes while preventing diversion to illicit channels and non-medical use.
The event was well attended by stakeholders across agencies in Nigeria, from the customs to immigration and so on. Issues analyzed in the report include illicit financial flows related to drug trafficking and their impact on development and security. The report also explained the fact that illicit financial flows do more to developing nations, hampering on their attainment of sustainable development goals in these countries. According to the report, an estimated $88.6 billion accounting for roughly 3.7% of Africa's gross domestic product is lost to illicit financial flows every year. Addressing illicit financial flows needs to be a priority for governments. Participants at the launch dialogued on the content of the reports as well as issues in country. And that's our package for today. Please join us same time, same station next week for a fresh edition. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food product peddlers, our doors are always open.
You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email, reforms@nafdac.gov.ng, or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded.
Importing, producing, distributing and selling fake drugs and cosmetics, adulterated food and so on are criminal activities that destroy lives. Join the fight against these heinous crimes by reporting any suspicious activities in your area to NAFDAC. Let's join hands to safeguard the health of our nation. See you next week. Stay safe.